Associate Executive Director for Population Science here at the Pennington Biomedical Research Center. Today we are releasing our 5th annual statewide report card on physical activity and health for children and youth in Louisiana. The primary goal of the report card is to assess the level of physical activity and the level of sedentary behavior, as well as the facilitators and barriers to these behaviors among our children and youth. The theme of this year's report card is on the built environment. In other words, we are what we build. The Pennington Biomedical Research Center's mission is to discover the triggers of chronic diseases through innovative research that improves human health across the lifespan. This makes the Pennington Center a natural leader for this endeavor in terms of improving children's health in our state. The target audience for the report card is really the adult decision makers in the state, more so than the children themselves. Adults are always grading children and providing feedback to them. Now this is our opportunity to actually provide feedback to adult decision makers and hold them accountable for our children's health. The report this year serves as an advocacy tool for parents, for teachers, school administrators, as well as physicians and nurses or anyone that works with children in our state. The report card provides data on a yearly basis on the most up-to-date statistics for physical activity and health in our state, enabling us to track our progress at improving child health. This year's report card was developed by a research advisory committee convened by Pennington Biomedical Research Center, and it included representatives from across the entire state. So now I'd like to turn to this year's results. I'd like to note that there are 2 versions of the report card. One is the thicker, authoritative, more evidence-based document with all of the data, and we also have a shorter executive summary with all of the key points. So this year, the grade for Louisiana was again a D. This grade has remained unchanged since we began this report card process in 2008. And this grade indicates that there are insufficient opportunities for children and youth in Louisiana to be physically active. In contrast, a grade of A would mean that children would be physically active and they would be achieving optimal health. So we have a grade of D again this year. This may seem like a poor grade and it may portend serious consequences in the future for our children. And this comprehensive look at the status of our children really continues to be an important resource for those of us in the states, in this state, concerned with children's health. So we need to be aware that even with vigorous interventions at the individual level and the public health level, these indicators take some time to change. You know, we've been on a downward spiral for many years. It's going to take some concerted effort to turn this around. So the fact that the grade has remained unchanged for 5 years, I don't think surprises a lot of people. So we're excited about a new component of the report card this year. This year we contracted with the LSU Public Policy Research Lab to conduct a survey among 750 Louisiana parents from across the state. First, 95% of parents think that it's very important that children are physically active. So that's really good news. They recognize the importance of physical activity. However, only 50% of parents realize or think that the obesity problem is worse in Louisiana than in other states. The other 50% of parents think we're actually doing better or we're about the same as other states. Now this is a little concerning that they don't realize the problem given our status as one of the most obese states in the nation. Finally, 85% of parents, when asked, think that they, as parents, should lead the charge in tackling childhood obesity. Only 3% of them think it's a problem for the government. Only 3% think it's a healthcare problem. 85% think parents are the ones that should tackle childhood obesity. Less than 1% said it was the responsibility of our teachers. So parents are taking responsibility for this problem. We need to educate them and provide them with tools to tackle the problem. So in closing, I'd like to emphasize the development of this report card has been a statewide initiative with the research committee from across the state, and we've pooled resources statewide for this. The report card has become an advocacy tool for educating the public and shining light on the problem of childhood obesity. Now it's up to us as parents, teachers, school administrators, and as voters to really create environments which provide ample opportunities for our children to be physically active. Now, we've received generous support from our partners and from our sponsors to undertake this work. This just highlights the need in our community and the response that we're getting. So I sincerely thank all of our partners for their support.